Hi, I'm Dr. Charlotte. I am a board-certified ophthalmologist. I've been practicing medicine for about 12 years after 14 years of training. And today I would like to talk about alphabet soup and billing and coding. The topic of today's Facebook Live video is explanation of benefits, or EOB. And the reason why this topic is close to my heart is because there are other things that can affect or damage the relationship with our patients. Maybe there's a personality conflict or other medical things, but it's also very important that we understand the financial aspect of medicine. And basically what an EOB is, or an explanation of benefits is that it tells the patient exactly what you did to them and what their insurance company pays. And I have a personal story. I had referred my mother to a dentist, a colleague, and they had asked for the entire payment of her visit up front. So my mother, thinking that because she had insurance that she would only have to pay the copay of the policy, they basically collected the entire amount. So she went to the dentist and she paid $450. However, the dentist had told her, we're going to send you the money back after the dentist office gets reimbursed. However, when my mother got her explanation of benefits, the exam that the dentist did not correlate with her explanation of benefits in order to get reimbursed the $450 that she wanted to receive, since her insurance was paying for most of the visit. And what we had found out was that the dentist secretary had left off some of the codes, even though they had collected for some of the codes or the dental exam. And as a result, the claim was resubmitted, she was reimbursed. However, she never wanted to go to that dentist again. She felt that she had insurance, that she paid $450, and it took her 3 to 4 months to get her money back. So even though the dentist was a very competent dentist, a quality dentist, recommended, because the business side of the visit was messed up, she didn't want to go to the dentist anymore. So an example of an EOB is what the doctor does and what your insurance reimburses. For example, when you take your child to the pediatrician for a well child visit, the pediatrician usually bills you for a well child visit. Well, if they get shots, then the pediatrician bills you for the vaccines, and then he's also allowed to bill you for the nurses administering the vaccine. So when you get your EOB from the pediatrician's office, it'll say whatever the well visit code is, what the insurance company paid the pediatrician, and what you owe. The vaccines, how much the insurance company pays for vaccines, how much you owe for the rest of the vaccines, the same amount. What's the insurance company allows to pay the nurse to inject the vaccines, and what your portion is. So the EOB is the language of payment between the patient and their insurance company, and the insurance company of what it sends to the doctor, or if the provider charges everything up front, then the patient should be reimbursed after what is not charged. For example, I'm a pediatric ophthalmologist. In addition to doing eye exams, my subspecialty is actually strabismus, or misalignment of the eyes. So if someone comes to me for the first time, I do a complete eye exam. I do check them for glasses, which is called a refraction, and then I do something called a sensory motor exam. So the sensory motor exam is an exam of the eye movements and all 9 gazes. So if my patients get an EOB from their insurance company, it will talk about the eye exam, which is one charge, the refraction, which is another charge, and a sensory motor exam, which is a third charge. So one good thing is to always have an explanation to your patients of what you're charging for. So sometimes the refraction or the actual exam for the glasses that we put a patient in the phoropter or we use another instrument for is not covered by insurance. So we actually have the patient sign a piece of paper saying this code is different from your eye exam and we expect payment at the time of the visit, and if your insurance happens to cover that, then we will reimburse you. And then we also have patients that we tell, hey, since you're coming for this special examination for your misaligned eyes, there is an additional charge for the measurements in all 9 fields of gaze. So we always tell patients that they're responsible for knowing what their insurance company pays for, but we know a lot of that falls back on us. So we should be able to speak the language of medical business. So ultimately your patient will get a letter in the mail of what was done to them. We don't want them to have sticker shock. You know, and you make sure your staff is trained to let them know, so the patient doesn't just not show up because they felt that they got a too high of a bill. And then ultimately, as physicians, we want to make sure that patients are taken care of properly, that the communication lines are open. And let's be honest, in this day and age, people have a lot of different places where their money needs to go or has to go. So if we set those expectations up front before the patient comes, and we are able to educate them about their healthcare plan and what they owe, then it just makes our relationship so much easier. So we don't want a patient to come to us and then never seek previous additional treatment. And then a happy patient is basically an advertisement for us. My talks are really geared to physicians who are in their first 5 years of practice, because I had to learn to speak the monetary language of business in order to make sure my patients understand what they're responsible for. So the lights in the office can be kept on, so your secretary is there to answer the phone, and you're able to purchase the supplies you need to run your practice. So explanation of benefits, that is the topic of the day. We receive an explanation of benefits from a patient will receive an explanation of benefits from their insurance company, letting them know what was performed and tests that were done when they were at the doctor. And then when you as a physician get your reimbursement for the insurance company, you have a copy of that explanation of benefits attached to your check, so you can reconcile your checkbook and make sure that you have received the money for the services that you provided to that patient, and hopefully you have helped that patient and made their life and world a better place. I'm Dr. Charlotte, and you can follow me on Facebook, Dr. Charlotte MD. I'm also on Instagram with the same handle on Twitter. And if there is a specific topic that you would like discussed about the business side of medicine, please shout out and put your questions or concerns on my Facebook page. I'm not sure about the topic for next time, but I am excited to educate young doctors about the business side of medicine. I think we take that for granted because we spent so much time learning to provide excellent health care, but without addressing that money aspect of medicine, we can't help people because people may not be able to afford our services or understand the value of our services. So have a blessed day. Thank you.